Institute of Health Technology, and this is our institute. Kalam Institute of Health Technology has been set up in the name and honor of Dr. APJ Abdul Kalam, is one of its kind globally. It's a Government of India project supported by Department of Biotechnology. It also draws its credibility from the fact that Kalam Institute itself is housed in AMTZ Vizag, which is the world's largest medical device manufacturing research development cluster. Kalam Institute of Health Technology is a pioneering institute dedicated to driving innovation and excellence in the field of healthcare technology. Our institute is committed to advancing healthcare through the integration of cutting-edge technology and impactful research. Kalam Institute of Health Technology is also a JBI affiliated group, as you can see.
Academicians think of this as too practical, and practitioners think of it as too theoretical. We are somewhere in between. We use knowledge. We actually convert information into knowledge. Theoreticians practice information. We extract that information, convert it into knowledge, convert it into formulas of practice, and we actually inform decision making. So somewhere we are a bridge and a via media between information and knowledge, or theory and practice. Now, Kalam Institute of Health Technology, which is a JBI center, has been a stalwart in medical technology and health technology assessment, evidence-based strategy development for a long time. For last 7 years, we have informed several best practices, innovations, and guided them to be absorbed in health system. It ranges from right from auto-disabled syringes, which are today used in vaccination, which was the first HTA implementation work that we did, to induction of low-cost portable ventilator during COVID in the national health system. It ranges across innovations, medical technology, pharmaceuticals, infection control items, and so on, because all these things play a critical role in our delivering of services efficiently and safely. Having said that, the JBI is a unique endeavor from the Joanna Briggs Institute, University of Adelaide, and in its affiliate group and center here at Kalam Institute, to be able to work with them in a more global way. So whatever we generate, that's why it's called gLocal. Whatever we generate locally, if that evidence can be scaled up globally, that is the purpose of JBI and our relationship, professional relationship with JBI.
As you can see by this graphic, we really feel like those 4 C's that we added several years ago to the model are the drivers of the momentum required to get evidence into practice. And I think that's a really important focus area that we probably haven't paid sufficient attention to. We don't talk about them very much, we don't articulate them, but we know that they are the things that require attention in order to see change happen successfully.
Whenever you think about innovation and how you develop an evidence, there are always 2 major segments. What is the need for the innovation, and how do you develop a value story? And the value story, again, is comprised of 2 entities. One is value story from a healthcare perspective, value story from an economic perspective. How best your innovation can be if it is not cost effective, and if it's not available to every human that is in need, it's not worth of an innovation. So that's the reason we always develop these value stories from an economic perspective as well.
The role of evidence in innovation is at every stage. It starts from understanding what problem to solve, then finding out what solutions will work, what solutions won't work. And when you've made the solution, you need to find out whether the solution is safe, is it effective, and is it cost effective. And finally, of course, the holy grail for any technopreneur is how to convince buyers to buy the solution. At every stage, evidence would be required. So innovators are well advised to make themselves familiar with the language, the skill, and the craft of evidence.
We are thinking of the robotic companions, assistants, and further there is a improvement with the technology, artificial intelligence, and so many things are in the innovation market of the assistive technology. There are so many.
I know the innovations is usually seen as AI, appliances, new technology and everything, but intervention mapping is one of the innovations in behavior change communications, which is a very evident health promotion tool and a way for future. So why was it developed? Basically to address questions about theory, empirical findings from literature and data collected from population, but to create an effective behavior or systems change intervention. Let's look at the overview. So basically, it's a systematic and a stepwise approach. It is grounded in community participatory research methods and to ensure that intervention matches priority population needs and the intervention context. Usually, innovations are sometimes made with a perceived connotation of what the society may need or what they have or they don't have. But this approach asks us to go on ground, map their need, and make innovation accordingly. This helps us to utilize our resources, time, and everything. JBI is heavily focused on evidence-based research, and I feel that making good quality evidence will make us have good quality innovations.
Big thank you to all our speakers also, as they have taken time out from their busy schedule to participate in this webinar. Thank you again.